Hello, it's me, Myra. Time for another anatomy lesson. This week we're going to be going over the respiratory system. Your respiratory system is made up of your lungs, your airway. Those consist of your trachea, your bronchi and bronchioles, your diaphragm, your voice box, your throat, nose, mouth. Its main function is to breathe in oxygen and breathe out carbon dioxide. It also helps protect you from harmful particles and germs and allows you to smell and speak. The main function of the respiratory system is to pull oxygen in from your body's cells and get rid of carbon dioxide, a waste product. You do this by breathing in, breathing out, and through gas exchange between the small air sacs of your lungs, called alveoli, and the blood vessels running nearby. Respiratory system also warms and adds moisture to your air you breathe in. Respiratory system warms the air to match your body temperature. It moisturizes the air to bring it to the humidity level that your body needs. It also protects your body from particles you breathe in. Parts of your respiratory system can block harmful germs and irritants from getting in or push them out once they get in. It allows you to talk. Your air vibrates your vocal cords, which makes sound. It also helps you smell. Breathing in air moves its molecules past your olfactory nerve, which sends messages to your brain about the way something smells. It also balances level of acidity in your body. Too much carbon dioxide lowers your body's pH, making it very acidic. By removing carbon dioxide, the respiratory system helps maintain the acid-base balance in your body. So once again, what are the parts of the respiratory system? Nose and nasal cavity, mouth and oral cavity, sinuses, pharynx or your throat, your larynx or your voice box, your trachea, your windpipe, bronchi, your large airways, your lungs, your diaphragm. Bronchioles are the small ones in your lungs. Okay? So your respiratory tract starts with the nose and the mouth, where you pull in the air into your body. Other parts of your respiratory system include your nasal cavity, your sinuses, these hollow areas. There's frontal, ethmoid, sphenoid, and frontal. Okay? It also So they're in your forehead and your cheeks, okay? Your lower respiratory tract consists of your trachea, your bronchi, and your lungs. Your trachea, bronchi, and bronchioles, the small airways, make up your tracheobronchial, pronounced tracheobronchial tree, a series of increasingly smaller tubes that transport air from upper respiratory tract to the small air sacs in your lungs called alveoli. It looks a bit like an upside down tree. So I'm going to turn you around. We're going to look at a diaphragm, a respiratory system, so you can get a better understanding of what we're talking about. Here we go. All right, let me get my little pointer. So we just talked about the upper respiratory tract, the nasal cavity, the oral cavity here. Now we have here's these alveoli, upside down tree we just discussed, bronchial here. So we have the upper respiratory is going to be here. So we have the trachea, the windpipe, we have the lungs, we have the heart. This is just giving you a better view of what the bronchioles look like in here. Then we had the diaphragm. Remember, that's the diaphragm goes between the lungs and the liver, and between the lung and the spleen. Okay, once again, here's your heart. You have these blood vessels coming all the way throughout your body down to your legs and arms, right there. Then I have one more to show you, a bigger picture. So once again, we have the sphenoid sinuses, the nasal cavity, the pharynx, the frontal sinus by your forehead, the nasal concha, your nose, your larynx, once again your voice box, your trachea is here, your bronchus, all these little vessels in your lungs. Bronchioles are the smaller ones. Here's your left lung and your right lung. And once again, a better view of your diaphragm right there. So I'm going to spin you around. And we're going to continue. I hope that gives you a little bit better understanding of what we are talking about today. So, we just talked about what's in our lower respiratory tract. We talked about what's in our upper respiratory tract. So how does it work? So your cells need oxygen to create energy. Creating energy releases carbon dioxide as a waste product. We talked about that earlier, which can harm your body if too much builds up. The main job of your respiratory system is to bring oxygen into your lungs, move the carbon dioxide out. It's called through a gas exchange. Okay, it works closely with the circulatory system, your heart, your blood vessels, and the blood to do all of this. Think of the oxygen in the air as passengers of millions of planes flying into the lungs every time you breathe in. Okay, your diaphragm pulls down, creating more space in your chest, which pulls air and its tiny oxygen cargo into your lungs. The air travels through your mouth or your nose, and passengers get picked up by a taxi at the airport. Finally, the taxi travels out to your tissues, dropping off oxygen to give your cells energy. So how does your respiratory system get rid of carbon dioxide? When cells use energy, they produce carbon dioxide. When the oxygen gets out of the taxi in your tissues, carbon dioxide molecules hop in. From there, they travel through your bloodstream and to the airport gates in your lungs. They fly out of your lungs when your diaphragm moves back upwards, making your chest cavity smaller and causing you to push the air out the way it came. Other functions. While you're breathing in and out, the respiratory system also protects your body from dry air and potentially harmful particles. When you inhale, your sinuses help regulate the temperature and humidity of the air. What are some conditions and disorders? Many conditions can affect the organs and tissues that make up your respiratory system. Irritants and germs you breathe in from the air include viruses and bacteria, and fungi can cause infections. They also can cause other conditions, such as allergic rhinitis, allergic reactions to tree pollen, pet dander, dust, and other allergens can affect your airways and passages. Chronic airway conditions. These include asthma, chronic obstructive pulmonary disease, also known as COPD, and cystic fibrosis. They can also create upper and lower respiratory infections. These are common. Some of these are common colds or influenza, also known as the flu. There could be blockages, there could be a foreign object, a benign growth, or a cancerous tumor. Acid-base imbalances are called respiratory alkalosis, and respiratory acidosis happen when you're exhaling too much or too little carbon dioxide, changing the acid-base balance in your blood. Too little oxygen or too much carbon dioxide in your blood or tissues, while they may seem like blood conditions, hypoxia, hypoxemia, and hypercapnia can all be signs that something's wrong with the respiratory system. What tests do healthcare providers use to diagnose respiratory conditions? A pulse ox, the little thing they put on your finger. It's a simple routine test that uses a device on your finger to measure your blood oxygen level. They can do pulmonary function tests. They can also do chest x-rays. They can take blood from you and do what's called an arterial blood gas. The treatments for respiratory conditions can be corticosteroids, bronchodilators. If you have asthma, you have the little inhaler. You can use that if you have asthma, COPD. That narrow your airways. You might use an inhaler regularly. Surgery, if you have tumors, surgery or for other blockages. You can also have lung transplant. If your lungs are that bad, then they might want you to have a transplant of your lungs. How can we keep our respiratory system healthy? Don't smoke or vape. Smoking causes many lung and airway diseases or makes them worse. Vaping liquids often have many of the same ingredients as cigarettes. Also, avoid pollutants that can damage your airway. This includes secondhand smoke, chemicals, and radon, which is a radioactive gas that can cause cancer. Wear a mask if you're exposed to fumes, dust, or other types of pollutants during your job or hobbies. Stay hydrated. Drink plenty of water that keeps the mucus in your lungs thin and easier to clear out. Exercise regularly keeps the muscles in your lungs strong and makes breathing easier. Always contact your provider if you have a long-lasting or worsening cough, shortness of breath, or any other symptoms of a respiratory condition. See your provider for regular checkups. Early diagnosis of respiratory issues can help prevent them from becoming severe. Now, before we leave, I would like to give you 3 different types of respiratory diseases: asthma, COPD, and also influenza or the flu. Asthma is a chronic lung disease that causes inflammation and swelling in the airways, making it difficult to breathe. Symptoms include coughing, wheezing, shortness of breath, and chest tightness. So once again, symptoms: coughing, especially at night; wheezing, a whistling sound when you breathe; shortness of breath, which can be severe and come and go; chest tightness, chest pain, or pressure; rapid breathing. What are the causes? Irritated cells in the airways produce more mucus than usual. Another cause could be muscle tightening around the airways. Treatment. There is no cure, but treatment can help keep symptoms under control. So once again, there is no cure for asthma, but treatments can help keep the symptoms under control. Treatments include the bronchodilators and the corticosteroid we talked about in the inhalers. Who does it affect? Asthma affects people of all ages, but is often started in childhood. It's the most common chronic disease among children. So also when to seek help again, if you have symptoms of asthma, you should speak to your healthcare professional. I'm going to go on from asthma. We are going to go on to COPD. Once again, COPD is short for chronic obstructive pulmonary disease, COPD. What is it? It's a lung disease that makes it difficult to breathe. It's caused by damage to the lungs that reduces airflow. What causes COPD? Smoking. Cigarette smoking is the primary cause of COPD. Also, it is caused by damaged air sacs. Emphysema is a type of COPD that damages the air sacs in the lungs. Inflamed airways. Chronic bronchitis. It's a type of COPD that causes long-term inflammation in the airways. What are symptoms of COPD? Shortness of breath, a cough that produces mucus. Wheezing is a high-pitched whistling sound in the lungs. Also, a symptom of COPD is chest tightness and unusual tiredness. How does COPD progress? COPD is a progressive disease, meaning its symptoms get worse over time. Severe COPD can make it hard to do basic activities like walking and cooking. So what is the number one thing a person must do if they have COPD? They just have to take care of their lungs best they can, talk to their doctor, pulmonologist, and get on some kind of treatment or treatment plan. Okay, that's COPD. So that's the number one thing they need to do, okay? Hypoxia is a condition that occurs when the body or a part of the body doesn't receive enough oxygen. It can affect the entire body or just a specific region. Hypoxia can be life-threatening. What are the symptoms? Confusion, restlessness, rapid heartbeat, difficulty breathing, and bluish skin. What causes it? Chronic heart and lung conditions. What is the treatment? You must seek immediate medical attention if your blood oxygen saturation level falls to 88 or lower. So we talked about putting that pulse ox on your finger. If your O2 is 88 or lower, you need to seek immediate attention. In the body, so the symptoms are confusion, restlessness, rapid heart rate, difficulty breathing, and bluish skin. What if you're in the water? Effects creates dead zones where aquatic life can't survive. Example, the Gulf of Mexico hypoxic zone, which forms every spring. How does hypoxia occur? In the body, hypoxia occurs when there's not enough oxygen reaching the body's tissues. In the water, hypoxia occurs when there's not enough dissolved oxygen in the water. So once again, hypoxia is low levels of oxygen in your body tissues. It causes symptoms like confusion, restlessness, difficulty breathing, rapid heart rate, and bluish skin. Many chronic heart and lung conditions can put you at risk for hypoxia. Last but not least, we're going to go on to flu, influenza. Flu symptoms include a fever, a high sudden temperature, headache, aches and pains in the head, cough, a dry or chesty cough, sore throat, pain in the throat, running or stuffy nose, your nose is congested, muscle aches, or pain and weakness in the muscles and the body, fatigue, feeling tired and weak, chills, you feel cold and shivery, vomiting and diarrhea or upset stomach, more common in children, loss of appetite, reduced interest in food, difficulty sleeping, having trouble falling or staying asleep. Flu symptoms develop 1 to 3 days after exposure to the flu virus. Most people feel better within a week, but a cough and fatigue may last longer. To treat the flu, you would rest to help your body fight the infection, drink fluids to avoid dehydration, take aspirin or ibuprofen to reduce the fever and aches. You should always contact your healthcare provider if you have severe flu symptoms or at a high risk for complications. That is it. Hope you enjoyed the lesson, and I'll see you in the next one.